Hi, may I please speak with Ro Dominic, please?
Who's calling? This is his wife.
Okay, my name is Samantha. I'm calling on behalf of the Arizona Department of Health Services to discuss some health information and ask a couple of questions. Is it available right now?
Well, Rose actually in the hospital. Rose been in the hospital for the last 2 days or so, I think.
Oh gosh, I'm so sorry to hear that. So as long as I can confirm that I'm speaking with the right person. I know you said that you're Rose's wife. So I'll just ask if you could confirm Rose's first and last name, and then date of birth, and then hopefully we'll be able to kind of continue on in this process.
Sure. Rose spelled Rowe. And then our last name is Dominic. Domanek. His date of birth is November 1st, 1999.
Okay, thank you so much. And I'm calling today just because we received Rose's information and his test results indicating that he had tested positive for COVID-19 on August 18th of 2020. We're trying to get a better idea of some of his symptoms, how long he has been sick, and what something that's called a contact tracing, and that would be to prevent the spread of the virus. All of the answers will remain confidential. Do you have time to answer some of these questions for me today?
Um, yeah, I should have some time.
Okay, great. And it looks like I have an address listed as 99 Kensington Center. Is that the correct address?
Yeah, 99 Kensington. Yes, yes.
Okay. And it looks like the city is Pattaya, Arizona at 85271. And are you currently living on tribal lands?
We're not.
Oh,
No.
okay. And now I'm going to read off some symptoms. So I'll just need to know which of the symptoms Roe has experienced during the time of his illness. So we'll start with fever, sore throat, and cough. Has he experienced any of these?
Yeah, he had a really bad fever the first couple of days.
Okay. And what about any like shortness of breath or difficulty breathing?
Yeah, he had a lot of difficulty breathing. That's why we took him to the hospital. He said
Okay.
he was feeling like he can't catch his breath.
Okay. And what about chills or rigors or it's called shivering?
Um, I don't remember him having any of that.
Okay, no worries. And do you remember if he had any headaches or muscle aches or sore muscles?
Um, no, he didn't mention that.
Okay. Do you know if he felt nauseous or experienced any vomiting or diarrhea?
Um, yeah, he did say he was nauseous. But we weren't sure if that was because he couldn't catch his breath and he was just starting to panic or what was going on.
Right. Okay. And what about like a runny nose or cold-like symptoms?
Um, no, I don't remember him having any of that.
Okay. And did he seem to feel any like more fatigue than normal, or did he lose his taste or his smell?
Um, he did say he was feeling more tired than normal. But he didn't say anything about losing taste or smell.
Okay. And did he notice any reddish blue discoloration of his hands or feet? It's something that we call COVID toes.
No, no, he didn't say that. And I didn't notice either.
Okay, and off the top of your head, were there any symptoms that I didn't mention that he might have been feeling?
Um, no, I think that was it. I think
Okay,
what stressed us out the most was him not being able to breathe too well.
right, okay. I understand that that's probably very, very scary.
Oh yeah. Yeah, we took him right away.
Right, but it sounds like you're doing all the right things, so that is definitely good. And do you remember by chance on what day he started to feel kind of sick?
Um, I think it was like 2 days before we went and got tested. 'Cause I just kept telling him, hey, maybe you have COVID. Because he wasn't feeling that great. So it must have been like 2 days before he was tested. Um,
Okay. And I believe I mentioned that, we got those positive results back on the 18th. So does the 16th sound right for when he started kind of feeling sick?
um, that sounds right.
Okay. And do you know if he was also diagnosed with pneumonia, whether it be clinical or radiologic?
Um, Not that we know of yet. I'm waiting for the doctor to give me a call back, at some
Okay.
point today.
Okay. And this you might not know either yet, but do you know if he was diagnosed with acute respiratory distress syndrome?
I don't know either.
Okay, no, no worries. I know it's probably difficult answering these questions for your husband, but I appreciate you doing so. And I know you said that Ro is in the hospital right now, and it's been
Mhm.
it's been 2 days. Is that correct?
Yeah, yeah, we took him in, must have been Tuesday night.
Okay. So the 25th, does that sound correct?
That sounds right, yeah.
Okay, and he's still there right now?
Yeah. We're not sure when he's gonna get out. I think they transferred him to the ICU. Um, so we're not sure.
Okay, I'm sorry to hear that. And do you know, when he was hospitalized and moved over to the ICU, was he intubated or put on a ventilator at all?
Um, I don't think so. I don't think they've put him on anything like that.
Okay, and the last question is, if he was put on a machine called an ECMO machine, it would be an extracorporeal membrane oxygenation machine. And was he put on one of those by any chance?
Um, no, that doesn't sound like anything I've heard them talk to me about. I'm not really sure what that is either, but it doesn't sound like anything I've heard so far.
Okay, it is, it's a machine that is typically used to pump, and circulate blood through an artificial lung and then back into the bloodstream. It's a lot of the time for very ill individuals, so just wanted to make sure that he has not been put on one of those. Um, and the next question is about some of his prior health conditions. So, prior to COVID-19, was Roe diagnosed with any of the following conditions: diabetes, obesity, cardiac, or heart disease?
Um, no, no, he's been thankfully pretty healthy until now.
Oh, good. Okay. And I do have a few more to ask about, so bear with me. But what about high blood pressure, hypertension, or asthma?
He did have some asthma issues, but I mean, it's been a few years since he's had problems with them.
Okay.
Um,
And then what about chronic lung disease, which might be like COPD or emphysema, or chronic kidney disease?
no,
Okay. Any chronic liver disease or current or previous cancer of any kind?
um, no, no.
Okay. What about any other immune compromising condition? So this might be HIV/AIDS, Crohn's disease, an organ transplant, anything that sounds like it'd fall in that category.
Um, no, no, he's been pretty healthy, thankfully.
Okay. And then what about a medication that might lower his immune system, such as like a chemotherapy or a systemic steroid?
No.
Okay. And last but not least, has he experienced any seasonal allergies or has he been diagnosed with that?
He does have seasonal allergies. They kind of get worse in like the fall.
Okay, I totally understand, and I do just want to let you know that moderate to severe asthma may put people at a higher risk for severe illness from COVID-19. I know you said he hasn't suffered from this before, but I did want to provide this information for you. And COVID-19 can affect your respiratory tract, which would be your nose, throat, and lungs, to cause an asthma attack and possibly lead to pneumonia or another serious illness. So if you have any other questions regarding that, I would definitely recommend contacting your primary care provider.
Okay, thank you. Yeah, I will once we get him out of the hospital and everything.
Right. Okay. And is Roe a current or former smoker? And this would include vaping.
No, he doesn't smoke.
Okay. And now I'm going to ask a couple of questions about the 2 weeks before Roe first developed symptoms. It can take anywhere from 2 to 14 days from the time that he was exposed to the virus to the time that he can begin to develop those symptoms. So we're interested in this time period because it can sometimes give us a better idea of where he may have been exposed to the virus. So some of these questions might be a little bit harder to recall. But is in the 14 days before Rose started feeling sick, did he have close contact with someone who tested positive for COVID-19 or someone who was feeling COVID-19 like symptoms, like maybe a cough or a fever?
He had a friend. He went over to a friend's house, and when he came back, Ro told me that his friend was kind of like coughing and like just said that they were sick, but they didn't say anything more than that. So I'm guessing that they probably had COVID too, by the sound of
Okay.
it.
Okay, and in the 14 days before Rose started feeling sick, did he attend any gatherings of 10 people or more? And this does not include a workplace setting, so this would be more along the lines of parties, protests or rallies, any faith-based events. Do you know if he went to any of those types of events?
No, we've been trying to be good about just kind of going to work and home.
Okay, good. And now we're going to ask about some of the travel history and possible sources of Rose's COVID-19 infection. So, in the 14 days before he started to feel sick, did he do any traveling within the US or within Arizona?
Um, no, no, we've just been going to work and sometimes a grocery store, but we haven't traveled or anything like
Okay.
that.
Okay, so you haven't left the United States either?
No.
Okay. Just wanted to confirm. And now we'll have to collect some basic information about Roe. So some of these questions will be similar to what you might see on when you go visit the doctor's office, some of those forms. So what gender does Roe identify as?
Male.
Okay. And what is Roe's ethnicity?
Um, I think he Hispanic.
Okay. And then what is Roe's race?
Um, I don't know really. I think he usually just says he's Hispanic.
Okay, that is no problem. And in the 14 days before Ro got sick, I know you said you were, really focused on working and then going right home. So was Ro working in a full-time or part-time job or doing any volunteering?
Yeah, he's been working part-time right now. Um, they've cut back on some of his hours at work, so
Okay.
he's down to part-time.
Okay, and in order to detect outbreaks and protect the health of the people who are at risk for developing severe outcomes from COVID-19, we have some questions about where Roe works, and we will not share any of the information with Roe's employer without any of your permission. So, in the 14 days before Roe got sick, did he work or volunteer in any of the following places? And I'm going to go ahead and read a few off to you. So did he work or volunteer in a long-term care facility, healthcare facility, or a facility serving a vulnerable population?
He works at like an assisted living home. Um,
Okay. And what about, did he do any other work or anything like that in a school facility or like a child care or summer camp, a place serving children?
no, no, he's just been working at the assisted living place.
Okay, and then the last few are any work being done in a correctional facility, government office, or law enforcement facility. Any of
No.
those? Okay. And if I could go ahead and just get the name and the location of the long-term care facility that Roe works at, that would be great.
Yeah, let me see. You said the name of the facility?
Yes.
The name of the facility is called it's called Bridges, like um I have a hard time forgetting. Ridges on the Road, I think it's what it's called.
Okay. No problem. I will go ahead and leave a note of that. And at Ridges on the Road, what is the position or the work that Roe is doing there?
He's a nursing assistant.
Okay. And this might be might be difficult, but do you by any chance know the address or even the crossroads of the facility?
Um, I don't know the address, but it's on 7th Street, um, and Campbell.
And you said in Campbell?
Yeah.
Okay. And what city is that in? Is that in Phoenix or
I
what
think
city is he working in?
um I think I think it is Phoenix.
Okay. And do you know the zip code? No worries if you don't. I know it's pretty difficult to answer these questions for someone else.
No, I don't know the zip code. I'm sorry.
Oh, nope, not a problem. And in the 2 days prior to the onset of Roe not feeling very well, do you know if he physically went in and attended work at that long-term care facility?
Yeah, he was working that weekend when he started feeling sick.
Okay. And so let's see. So I remember, he got sick, closer to the 16th. So on that weekend, you said that he was in there working?
Yeah, he's working Saturdays and Sundays right now.
Okay. And was he able to let his employer know about his positive test?
Um, yes, I think so.
Okay, and we'd like to send you a public health absence letter just to make sure that Roe is excused from work, and even a fact sheet about COVID-19. So I don't know if it would be better to collect his email or your email. What's the best email address to send that information over to?
I think I can get it at my email. That way I can send it over to his work.
Okay, perfect.
Um,
And what's your email address?
my email address is it's iz 17 at gmail.
Okay. So just to confirm, that is iz17@gmail.com.
Yeah, that's right.
Okay. And now what is your current living arrangement? Are you and Ro living in a single family household, an apartment building? Um, what is that arrangement?
We live in an apartment complex right now.
Okay. And other than you, do you have any other people that live in the house with you? Maybe any children or other siblings?
It's just the two of us right now and our pets.
Okay. And the next part of the survey is about following up on any symptoms you and Ro and his household members, so that would be you, might be having. Because we don't have a vaccine for COVID-19 yet, recording current and or newly developed symptoms is one of the only tools we have to prevent the spread of COVID-19 in Arizona and ultimately save lives. So Ro and yourself are the household members, and we'll want you to monitor for any symptoms that you might have of COVID-19 and be able to report these to public health for 14 days. This will be done using the state of Arizona's automated system. So either depending on who wants to be the point of contact, you'll receive a reminder each day, and this will be either by email or by text message to record the symptoms. It'll take less than a minute to complete and lasts only for the duration of your recommended quarantine period. At the end of the quarantine, you will be able to be unenrolled from the system and will not receive any additional correspondence. So to record the symptoms in the automated system each day, one person will have to answer for everyone in the household. Is this something that you would like to do?
Um, yeah, I can do that since he's still in the hospital. I don't know when they're gonna let him out. I can do that for us.
Okay, perfect. So I'll go ahead and designate you as the point of contact. So can I please get your name?
Yeah, my last name is, or sorry, my first name is Isabel.
Okay, and you have the same last name as Ro?
Yes,
Okay. And I know you mentioned that you were Ro's wife, is that correct?
that's right.
Okay. And Isabel, what is your date of birth?
My date of birth is November 1789.
Okay. And I know you said that your email is iz17@gmail.com. What's a good phone number for you?
I would say you can probably use my phone number. It's 480
Okay.
712 4397.
Okay, perfect. Um, and would you like to use your email address or the text message to be reached?
Um, probably text message.
Okay, I can do that. And let's see, so it looks like you gave me the phone number of 480-712-4397. Is that the best number to send that text over to?
Yeah, that'll be better.
Okay. And is this a smartphone that has internet access?
It is.
Okay, great. And now that we know what the household looks like, we'll make sure that everyone in the household, so you and your husband, are both being monitored. I know it's just the two of you, so I just want to confirm that I have all of the information. So it's just you two living in the house together, correct?
It's just the two of us, yeah.
Okay. And I'm gonna have to go ahead and um, type in your information again. This is again just to make sure we have everything submitted properly. So you will go ahead and 1117 of 89. Is that correct?
That's correct.
Okay. And when was the last date of exposure that you had to row?
What do you mean?
So typically we want to, measure and determine your isolation and quarantine guidelines. So typically what happens is anyone who's feeling sick will have a 10-day isolation period. So for example, Roe is going to be isolated from the 16th to the 26th. And we want to know when the last time you saw him was, so we're able to calculate your quarantine guidelines because it'll be 14 days, since the last time that you came in contact with Roe.
Well, the last time I saw Ro, it was Tuesday, when we took him to the hospital. They didn't let me go in or anything with him.
Okay,
But
so you
I
haven't seen them since the 25th?
mm-hmm. Yeah,
Okay,
they haven't let me in to visit, and I'm able to call him on like their hospital phone, but I haven't seen him.
okay. And so it looks like that will bring your quarantine end date to September 8th, just because it's a 2-week time period from the last time that you had come in contact with Roe. So now that we have that completed, I'm going to want to go over any other close contacts that Roe might have been in contact with. So we're looking at the time that Roe was infectious and able to spread that virus, which starts on the 2 days before those symptoms first started. And we'll define close contacts as anyone who Roe may have been within 6 feet of for more than 15 minutes. So since 2 days before the symptoms started until now. And then, just because, he is in the hospital and he's considered more of a severe case, so that'll be 20 days past the onset. So it looks like we're going to want to collect that information from the 14th, which is 2 days before he started feeling sick, all the way up until today. So even though public health will be reaching out to these people as well, we do recommend that you notify the close contacts of Roe of the test results, just so they can then limit their exposure to others. Roe's name will not be shared with any of the contacts. For each individual, I'll just ask for how to spell their first and last name, and then I will also need their age and date of birth. And then other than that, a way to contact them, either email or phone, would be great as well. I know this might be a little bit difficult because you might not be all that familiar with, the contacts that Roe is working with. But is there anyone that you can think of that falls into that category, within 6 feet for more than 15 minutes? Maybe this would be friends or extended family or people that he might be working with.
Um, we We've been trying to be good about not even visiting our family, just because we're kind of worried about COVID. But I don't remember him visiting any family or anyone else. And
Okay.
I'm not too sure about his coworkers. I'm sorry.
No, that's not a problem. I appreciate you trying to think back for me. If you do think of anyone or if someone does pop into your head, like I said, we do recommend reaching out and just letting them know of their exposure. So now I do want to talk to you about how long Roe is going to be infectious or able to spread the virus to others. Um, so Roe right now, I know he's in the hospital, but he does need to self-isolate and stay away from others just while being infectious. Um, so typically, we say for a non-severe case of COVID, the person would be able to spread the virus to others from 2 days before and 10 days after those symptoms began, and 24 hours fever-free without the use of a fever-reducing medicine. So this would cause that isolation period to be on the 26th. But because he is considered one of those more severe cases, we do recommend an additional 10 days. So just keep that in mind. We also do ask that anyone who has been in contact with Roe would self-quarantine for 14 days after their last exposure to him. For anyone um, who that he might share a home with, so this would be applicable for you. They'd begin their 14-day quarantine period at the end of the self-isolation period. So I know you haven't seen him since the 25th. So like I had mentioned, the 2 weeks from there, it looks like it would be on the 9th, not the 8th, because we do want to make sure we finish those 14 days first. And this means that you should probably not attend work or school if possible. And then anyone outside of the household can begin their 14-day self-quarantine from the last time that they were around Roe. So please remember that anyone experiencing symptoms should stay home and away from other household members as much as possible. And then, like I said, we want to make sure that you're feeling healthy as well. So please be sure to monitor for your symptoms as well. And we do suggest notifying anyone else that Roe might have come in contact with just of that positive test result. So please remember that everyone should be washing their hands frequently with soap and water for at least 20 seconds or using an alcohol-based hand sanitizer and wearing a cloth face covering when possible. We also do have a team dedicated to providing additional services such as housing assistance, financial assistance, mental health resources, and shelter services. So after our call, you may dial 211 or visit 211arizona.org for additional assistance. Thank you very, very much for your time today, for sharing some information. I know it was probably very difficult to be sharing some of your husband's information, but we really do appreciate it. Do you have any questions that I can answer for you or anything else that I can take note of for you today?
I don't think so. Would you give me that number for the assistance that you mentioned one more
Yes,
time?
yes, absolutely. So there are two numbers that I'm going to give you. The first one is for housing, financial, mental health, and shelter services. So that number would be 211, and so you can just dial that on your phone. And another number is to reach public health. So it would be talking to someone like me who's able to answer some questions for you. And that number is 602 649 4339.
All right, I got it. Thank you.
Awesome. Yep. Thank you very much. And is there anything else that I can help you with today?
I don't think so. Thank you so much.
Okay, perfect. Again, I want to thank you so much for your time today. Have a great rest of your day, and I hope Ro is feeling better soon.
Thank you.